Seeking the unseen. Detection of secondary membranes for successful outcome in vitrectomy for diabetic tractional retinal detachment. First of all, let's find out what are secondary membranes. This video would amply demonstrate it. Here is a piece of paper which is stuck onto a thin plastic sheet which is placed on a table. When you try to separate the paper, because it's glued, it does not separate out. But when you start identifying the edge of the polythene sheet and try to separate it from the table surface, it comes off very easily, very similar to that of the fibrovascular proliferations that are seen in TRD. If you go to the secondary membrane, you would be able to dissect it from the retina. Let's see in this video. When you're doing the dissection of these membranes, there would be situations wherein you cannot dissect any further because you cannot go to the cleavage plane. In this situation, it is always better to use a pick or any of the fine instruments like the bent MVR blade to identify this secondary membrane. Once you identify it, the dissection becomes a lot easier because this is the true cleavage plane. Here you can see that the secondary membrane is generally seen to be extending far wider than that what is obviously seen clinically. How do I detect these membranes? When you see that you are not able to access these membranes, you would know that there is a presence of the secondary membrane. And using one of the instruments like a pick, you can identify the secondary membrane and then dissect the fibrovascular tissue clear from the retina. Here's another example. We are not able to dissect this fibrovascular tissue. So here I have used a spatula to identify the secondary membrane. And once I identify the secondary membrane, the dissection of this tissue becomes easier. You can see that the membrane starts lifting off because now you are in the true cleavage plane. Why is it so important to identify the secondary membranes? This video will show you how it becomes very easy to dissect the fibrovascular tissue by identifying this secondary membrane. Using a pick, I've identified the secondary membrane, and once you reach this cleavage plane, the membrane tends to dissect very much easily by just blunt dissection. So majority of work is just blunt dissection, and you just have to cut those small points of attachment that is present between the fibrovascular tissue and the retina. Here I am using the scissors to help in the dissection, but you would see a majority of work is generally with blunt dissection. This is another example of a large fibrovascular proliferation very close to the macula, causing traction on the macula. And once you have identified the secondary membrane, here the secondary membrane is seen to extend over the disc and beyond. And once we identify that, the membrane dissects a lot easily. Once you have done this dissection, then you could use any of the instruments, either a cutter or a scissors, to help you remove this fibrovascular tissue, and the, the membrane dissects very easily. Here is another example wherein just a blunt dissection would help you remove these membranes. So, if you come to a situation wherein you are not able to progress in the membrane dissection any further, look out for the secondary membrane, because that would give you the cleavage plane and help in membrane dissection. So, the clue in diabetic vitrectomy is to be able to identify these secondary membranes to enable you to get a good surgical outcome in these complicated situations. So, in conclusion, detection of secondary